Patients that arrive in office may be complaining of having things like excessive tiredness, right? They might be feeling excessive fatigue. They may have nausea or bloating. They may have some increased abdominal pain. Abdominal pain, bloating, maybe even a little swelling. They may also have spider veins, kind of what are called spider veins. So the really superficial venules that are around the hands, around the face, these can be a little bit more apparent. So a patient may come in complaining of different signs and symptoms such as these, and then the physician will have to use these signs and symptoms to make a diagnosis, or at least on their way to trying to diagnose, right? So in diagnosing cirrhosis, as always, the physician or clinician is going to take a health history as well as a physical exam. So in the health history, they may ask about their social history involving alcohol use. They may ask about vaccination history and talk to them about if they've been vaccinated against hepatitis. They can talk to them about family history with genetics, things of that nature, right? They're trying to work out kind of exactly what risks of this patient at or currently at. And then the physical exam, they'll do a palpation, checking for enlarged organs, different swelling, things of that nature. In speaking to the physical exam, there are, as this disease progresses, there are excessive complications that arise. So much so that there's going to have to be other videos that really speak more on the long-term complications of cirrhosis that may be arising. I mean, long-term, this is an end-stage liver disease. So they may manifest sooner rather than later, but those will be in a different video. So along with health history and physical examination for some of these complications like excessive swelling, yellowing of the skin, etc., that'll be going over later. Next may come a liver biopsy, where they may remove a piece of tissue from the liver and send to pathology to determine if liver is completely scarred and this is cirrhosis, or they may do imaging. But before all of this, like, they could do CT, MRI, all that. And I apologize, this should be before this, because after this and this, they won't just jump to these sort of things. This is like the end stage diagnosis. After this and this, they really will go to blood tests first. So really, they're going to check probably a blood count to see if there's diffuse inflammation that you might see with that swelling and inflammation. They're going to check probably lipids, so they might do a lipid panel or a CMP, a metabolic panel, to check for liver enzymes like ALT, AST, albumin, alkaline phosphatase, etc. And then, depending on if these show elevated liver enzymes and increased inflammation, this is probably the next step. And then if this is non-confirmatory, this certainly would be. Thank you very much to the American Liver Foundation for this information.